So today I've got 7 cases to do. All are general anaesthesia apart from 2, so 5 GAs and 2 LAs. We've got a breast augmentation that we're starting off with. Then after that we've got another breast re-augmentation, so we're taking out old implants, putting in new ones, a blepharoplasty on the same patient and neck liposuction on the same patient, so multiple procedures on that patient. Then third patient is a breast augmentation, fourth is a breast augmentation, fifth is a breast augmentation. Then we've got an earlobe reduction and also a neck liposuction. So 7 cases in the day. It's going to be busy here on Harley Street, and yeah, I'm just excited to tackle it. I was operating yesterday on 7 patients, and the day before on 6, and the day before that on 5. So it's been a steady stream, and then tomorrow I'll be in clinic, and the day after I'll be in clinic. So life is varied, but one thing I know is that when I operate, I like to operate all day, and when I do clinic, I like to do clinic all day. I don't like to mix these two, and that's just my preference. So I get into a certain mode and just like to relax into whatever the activity is. But yeah, really excited for the day, and we'll take you through it as we go. .390cc is what we talked about.
Yes.
We've got the 390cc, so I'll write 390cc on there. 390cc. So have a look at that. If you're happy to go ahead, I need to sign, date and name over here. Give me a bit more of a better posture. That's it. That's it. So that's exactly perfect there. I can't operate without music. I gotta have music. I love my music.
What kind of music?
Oh, it's a lot of 80s and 90s stuff. But yeah, it's yeah, I love that stuff.
Hi, my name is Asta. I'm a ward nurse and recovery nurse. So what happened to our patient when they come here, we do blood pressure, we monitor, we do through the pre-assessment, we make sure if they done blood tests, if they're diabetic, we check their level. We do the whole pre-assessment, then we help them to wear the gown, head stocking, we do pregnancy and nicotine tests if they smoke, and we'll make sure that the surgeon is ready to do the marking area, the anesthetist check everything, but we are the main one looking after them before and after. So we are the good guys.
So I'm Zaib Tariq, I'm the consultant anesthetist. I work with Mr. Riaz Agha. I've been working for more than 5-6 years. As an anesthetist, my role is all part of the surgery. Before the surgery, we get all the patient notes, we get to review them, check all the bloods. During the day, I come in, I have a chat with the patients. Obviously, patients are very, very anxious. They don't know. Some of them never had a surgery before, never had an anesthetic before. So I explained to them about anesthesia, what anesthesia entails. I explained to him about during and after the surgery. I tell them about their pain control and about the post-operative medication they need to take. During the surgery, we are the most important safety net as anesthetists because the surgeon is just concentrating on the surgery. We are looking at the patient's airway, their breathing, their vital signs, their heart rate, blood pressure, everything else. And we are the safety net essentially. And if things which need to be addressed or if there is a change in the physiology, we do react, and that makes us the safety net.
So the next operation after having done the breast reaugmentation is going to be the neck liposuction. We use Vaser and power liposuction, also known as high definition liposuction. So they uses two different devices for us to do that. So first device we put in is going to be just to infiltrate with adrenaline and local anesthetic. Then we put in the Vaser, which helps to melt the fat down like a butter. And then we put the liposuctor in, which is like a hoover to suck out all the fat. It's easier to suck out butter than solid chunks. And that's how we do it. Just mark that. That distance there is about 8 millimeters. And then you can see that she's got all this extra skin here. So it's best to then curl this up to make sure you get that. Now you've got to see, have you got a non-toothed?
Yeah, I do.
So another decision is how much can you take? So you can take it until the lashes, they just curl up like that. And that's about as much. If you take too much more of that, she won't be able to close her eyes. So that's about what you can do. 8, and then above that, write 11, and then above that, write 15. So 15 is from the top line to the eyebrow, 11 is that piece that we're removing, and then 8 is to the lash line. Just putting in the local. And often you want that local anesthetic to work and kick in even more. There's a very, very slight opening of the eyes at the end of this operation, but as they become vertical and as the swelling reduces and the local anesthetic gets absorbed, gradually that will just close. We're going to give them ointment anyway, and so that they can easily use that to keep the eye hydrated. So I've got your consent form there. Are you happy with that? Yeah. If you want to sign that and countersign that on the line over here, sign name and date. Yeah. And it's 400 cc is what we said. Yeah, so let's sign name and date that one. Okay, it's 400 we said. Getting the midline is really important. Get the boundaries of this sort of box correct. And we said 330 or 390.
Hi, I'm Kirsty and I'm having chin and jawline liposuction in the hope to kind of tighten around the lower face here. Dr. Riaz is really great. I met him, I think, in February for a consultation, and then he also did my Botox recently. So he did the upper face and around the eyes about a month ago. He's very knowledgeable. So I'm just hoping that this procedure makes me achieve what I want, which is like tightening around here. I'm happy with the after result, but obviously I need to wait to see what it healed. He was able to take all of the fat, and then my goal is that it's going to tighten all of this part, which will then help tighten the lower face. That's my aim.